Many people believe that infectious diseases like hepatitis B are no longer a public health concern in developed countries like the United States. However, contrary to popular belief, and as shown by statistics and the lived experiences of Americans, 2.4 million people suffer from chronic infection of the hepatitis B virus in the United States, with only 25% of the population aware of their diagnosis and more than 50% of cases reported among Asian, Pacific Islander, and African communities. Hepatitis B is caused by a virus that enters the cell membrane of healthy liver cells and replicates at an alarming rate, effectively infecting and damaging the cell. This causes inflammation of the liver and can over time lead to critical health issues such as liver failure, liver cancer, or cirrhosis without proper intervention and treatment. Common modes of transmission include exposure of the virus from mother to child during pregnancy and childbirth, contact with bodily fluids such as blood through faulty blood donations or sharing razors, use of injection equipment, and unsafe sex practices. Prevention is possible. Safe and effective vaccinations can prevent the spread of the virus when administered in a timely manner. However, even after being diagnosed with hepatitis B, it is possible to live a healthy and fulfilling life. Just like any other medical condition or disease, it can be managed effectively through appropriate care. In recent years, the number of HBV infections has increased substantially owing to the opioid crisis, influx of diverse immigrant populations from Asian, African, and Middle Eastern regions, and lack of awareness about the disease that has led to an increase in the number of people who have hepatitis B but are undiagnosed. Lack of awareness about the disease is the predominant cause for why people with hepatitis B go undiagnosed. Most people do not know what the virus is and how it affects their liver. And since the virus can remain dormant for long periods of time and symptoms may not always be noticeable, people tend to ignore the importance of screening and getting tested. Health misinformation also plays an important role in why people may not choose to get their newborns vaccinated or themselves vaccinated against the virus. Culture and religious beliefs, poor knowledge of how vaccines work, and mistrust with the healthcare system are a few reasons for why the disease goes unnoticed and undiagnosed. For the immigrant populations residing in the United States, there are a lot of misconceptions about what a positive hepatitis B blood test could mean. Some believe that they may get deported or that a positive test could interrupt their naturalization process. Some fear that they may lose their employment. Others struggle to escape cultural conceptions about health and disease. They are afraid to get tested as they may not want to burden their families. For many people, living with hepatitis B can be emotionally and mentally exhausting due to the stigma associated with the disease. For those struggling with drug use and addiction, it is especially challenging to find a caring provider to talk about their lifestyle choices with, and to discuss the possibility of getting tested. Providers may have preconceived notions about people based on their age, race and ethnicity, socioeconomic status, gender, and education. Many also have difficulty accessing care in rural or suburban settings, or even affording treatment options. As a result, they neglect their health and delay treatment.
So the Hepatitis B Foundation has been around for over 30 years. Our mission is to work towards finding a cure for hepatitis B and improve the quality of life for those directly affected by hepatitis B. We do this through a variety of ways. We do policy and advocacy efforts at the federal level in the United States and internationally to raise the profile of hepatitis B, increase awareness, sensitization. Only about 10% of people are actually diagnosed with hepatitis B and at risk for liver cancer. So really improving access to treatment and care is at the forefront of our mission. We also work at the Blumberg Institute towards finding a cure for hepatitis B and improving the quality of life for those living with hepatitis B. The Hepatitis B established the Blumberg Institute, and since then they've been working on these initiatives to really elevate and work towards a cure for hepatitis B so people don't have to worry and live with the disease their whole lives. So the hepatitis B has a variety of programs. A lot of them are really focused on patient-centered efforts. So one of our most favorite programs was established in 2017, which works to bring individuals with lived experience living with hepatitis B or directly affected by hepatitis B to create their own stories through short video clips. What this does is it trains people to speak about hepatitis B and their experience and works to create awareness and messaging about hepatitis B to the general public and encourage others to speak about their illness, really working to improve awareness and decrease stigma. Another initiative that we have is looking at public health research. We look at barriers to access to care. We provide screening, education, and outreach in communities and best practice methods for other coalitions that are working in similar populations. We also do consultations with people living with hepatitis B. We answer their questions and concerns and direct them to appropriate resources to meet their needs and answer their questions that they might have. And we also work globally on discrimination, working to address stigma and discrimination against those living with hepatitis B. We have a bunch of other programs as well that we work on, and each program is directed by our consultation line. So if people are reaching out to us with a specific problem, we'll then create a program potentially to meet the needs if it's a problem that continues to come up. So the discrimination program came about because we were hearing from people being discriminated against because they couldn't get work or couldn't get visas to work in countries that they were trying to work and support their families. So that program is just getting off the ground, and it's just an example of one of our really important initiatives here at the foundation. One great success that we've had at the foundation, the Centers for Disease Control and Prevention, ACIP vaccination recommendation body, has recently recommended universal vaccination for hepatitis B. Vaccination is an amazing public health tool that we have at our fingertips. We have not done a great job at implementing the vaccine because it's risk-based right now. So providers are asked to look at all of these risk factors and make sure that their patient is tested. We don't record these risk factors as a part of the medical history and intake when we go to a provider, so it's really hard to implement this risk-based guidance. So with these new universal vaccination recommendations for adults between the age of 18 to 59, we're hoping that vaccine uptake will increase, more people will be protected and not at risk for hepatitis B, and we'll start to see these chronic infections really reduce in the United States as a result of that. We're also hoping that screening guidelines also will reflect the universal vaccination guidelines coming up as well. So the hepatitis B vaccine has been around for the past 30 years. It's extremely safe and effective and provides lifelong protection against hepatitis B. It's one of our greatest resources in terms of public health tools in the hepatitis B space towards prevention. We have seen, especially with the ongoing pandemic that's happening, as well as the anti-vaccine movement, kind of have a significant impact on really vaccine uptake overall. And so this is something that we're really working on addressing. We're hoping that these new guidelines, these universal guidelines, will really work to expand and really grow the prevention and the vaccine movement for hepatitis B as a whole. The movement has really impacted all vaccines, I would say, across the board. And it's a matter of figuring out how do we think ahead in terms of creating that education, messaging, and awareness that's simple and trustworthy and very to the point. This vaccine is one of the oldest vaccines around. It's been, again, over 30 years. We've had it administered into billions of people all over the world. I myself have gotten it. So just making sure that we're normalizing this conversation about vaccine and prevention and including hepatitis B within that space. And hopefully these new guidelines from CDC will really help us to expand and grow and really streamline prevention efforts and make them more sustainable in terms of practice and practical recommendations for the U.S.
Okay. I was diagnosed with hepatitis B in 2011 at Columbia University Medical Center in New York City. I had very little knowledge of the disease. It wasn't something I was very familiar with. I had to learn from the foundation and from reading materials and from some doctors that had to travel very far to see. And that's how I became knowledgeable of the hepatitis B virus. And being a storyteller, of course, enhanced my knowledge. Almost definitely. In my area, uh, everything was hepatitis C. All the specialists treated hepatitis C, and I had hepatitis B. So there wasn't any specialists around to treat that. Um, and being that I was HIV positive, so I was co-infected, and that made my window for treatment even smaller. And not having any HIV infectious disease specialists who really knew were very versed on hepatitis B. Um, so that was another reason why I had to travel so far to try to get care. And I successfully got care, but I had to travel so far to get it. So now I live in the urban, now I live in the urban area, New York City, and it's flooded with hepatitis B specialists. And most of the time, you get your treatment from your HIV infectious disease because they both have to be treated at the same time. Oh well, it's impacted. In the beginning, the ongoing was pretty rough. Trying to find living rural, um, living rural Kansas City. On the Kansas side in the country, where there is really no hepatitis B specialist nearby. So I had to travel 200 and I think it was 97 miles to find a hepatitis B specialist. So it was pretty damning. Um, I was depressed because I having really no knowledge of it. The only thing I could see is, the end is near, you know, and so, but that's how the beginning was. Now, I have a full range of knowledge of hepatitis B, and I'm happy to say that I spread it around. I tell people about it, and I don't have the lack of knowledge of it anymore. Honestly, stigma is just as thick as the air we breathe. It's everywhere you go. It's in every community. It's in every ethnic community, every racial community, every you know community you can even think of. There is stigma with hepatitis B. If it's not hepatitis B, it's something else. But there's heavy stigma, and I think that's the hardest uh, thing in trying to combat uh, uh, the hepatitis B is trying to eradicate the stigma um, by trying to get past people's thought processes and giving them correct information because the problem is to get incorrect information. And that makes our job extremely difficult.